Dominant toxins in her body was a toxin called xylocaine. Xylocaine is a numbing agent that they can inject into a person possibly before a C-section, or maybe it was used for a dental procedure or some other surgery where they can use this. The anesthesiologist may use the xylocaine to do some numbing of a tissue, just like Novocaine or Septicaine, that they can use in a dental procedure. Xylocaine is what I found in her, like lidocaine, a numbing agent. I found xylocaine in her blood. I found xylocaine in her diencephalon. I found xylocaine in her hypothalamus of the brain. I found xylocaine in her cerebral cortex tissue. I found xylocaine, let me finish with that. Xylocaine in her large intestine, xylocaine in her kidneys, xylocaine in her bone marrow. I found in her also, there's another sedative chemical called Versed that can cause tremors and dystonias, muscle tone changes. I found Versed in her brain. I also found Candida glabrata in the capillaries of her brain. I found Candida tropicalis in her hypothalamus, in addition to the xylocaine in the hypothalamus. Whenever there are toxins that can numb the body or put somebody to sleep, sedating the tissue, sedating the brain for a surgery procedure, what's going to happen when those sedative chemicals or numbing agents are still in the brain of a person, or in the bone marrow, or in the liver, or in the large intestine, or in the kidneys? What's going to happen to the function of the person's body? If a sedation chemical, when a sedation chemical can actually sedate the brain, make somebody high and not function well, and get them ready for a surgery procedure where they use an anesthetic to knock them out, what's going to happen when that sedative chemical is still in the brain of the person who's trying to develop? It's stopping the development. Does that make sense? I hope it does. It's stopping the development. It's hindering the performance of the development of the brain. What's going to happen when a numbing agent, xylocaine, is in the intestines, in the kidneys, in the brain, in the hypothalamus, in the diencephalon? It is causing a decrease in the ability of those parts of the brain and body to work at regulating her blood pressure, regulating brain function and development, regulating speech and walking. It's stopping that development. It's hindering the performance of the brain and the body. Hello, I'm Dr. Herman, and we're with a great patient. This is little Miss Onyx Smith and her mommy. And they came here from another state here in the U.S. to come in for care for Miss Smith's condition. She had a certain kind of syncope condition. So, and this started right after she was born, right? Right after the C-section procedure. Mm-hmm. And so right after the C-section procedure, did you notice when she first came out, was there a lack of cognition right away?
Yeah, she was just very stoic and just would just kind of stare.
And was there discoloration of the skin at that point? Like,
yeah.
Like not getting enough oxygen?
Yeah.
Was she looking bluish or?
Yeah, bluish, grayish, and even like a yellowish, orangish color to her skin.
Mm-hmm. And there was a procedure that was done right away. They did an MRI, but they had to...
an MRI and a rectal biopsy.
So they had to sedate her for that. And then after that procedure, did you notice even a worse condition develop?
Well, that was... the first one, you know, she was a newborn, so I didn't really know what to look for then. But after her second MRI at 1.5 years, almost 2 years old, I saw a distinct regression and reaction to it. The same night she had a bad syncope episode.
Mm-hmm. And how many syncope episodes did she have in a day?
Well, it was started out with, you know, the one every 3 months or something, and then it progressed into multiple times a day. And then since starting your protocol, it's tapered off to basically nothing.
None.
None.
Zero.
Unless, you know, we do her specific triggers.
And there was only one trigger, that was brushing her hair.
Brushing her hair, and then the plane rides, but even this most recent plane ride, she didn't have
this
one.
Last plane ride. Coming here, that wasn't.
Didn't have one.
When you first came for your first...
Yeah. The first time she had multiple.
First time she had multiple on the plane ride here and the plane ride home.
And the plane ride home.
And this time coming here today, she had none.
None.
Excellent. And her cognition before, was she able to even focus on you or focus on anybody around her, or focus on listening to statements from her before?
She would look at me, but it was a very distant look. It was almost like there was nothing behind her eyes.
And now we do have the video that you said that you had filmed before you started this first protocol. Mm-hmm. So we'll be able to show you, we'll be able to match up where she is now compared to what she was. And the other, she had the droopy eyelids, so it almost looked like she was falling asleep. Mm-hmm. Yeah. And was she able to follow any tasks if you directed her to do something like go into a room and get something and bring it back? Did she follow any direction from you?
No, she showed nothing that, no signs that she understood what you were saying to her.
And so right
She
after
would just
this,
kind of stare at you.
and right after this protocol now, she's able to follow.
Multiple task directions. I know, honey. We're going to go eat in a minute, okay?
She's able to follow multiple tasks. She can follow. She remembers things now.
Her memory is vastly improved.
And even forming some words now compared to before.
Yeah, forming a lot of words are really clear. I know, you want to go eat. I'm
But
sorry.
she's able to form some words now, and she's able to
And
actually...
even like 3-4 word sentences, it's still garbled speech, but you can actually tell what she's saying.
Mm-hmm. So that's
You
starting
know,
to come out now.
I go bye-bye.
She could
Stuff
say
like
those.
that.
And her memory, you actually said, is improving.
Vastly improved.
Dramatic.
Yeah, dramatic improvement in memory. You show her a picture in a book and tell her this is an elephant, and then later you go back and pull the same book out and say, what is this? And she'll tell you it's an elephant.
Excellent. Excellent. Very good. And so, again, it was multiple times a day. When you said the syncope seizure-like activity, that was multiple times a day. Was it only like, is 2 multiple to you, or is like 3, 4, 5? Is there a way to
Sometimes it would be 1, sometimes it would be 4.
And that was every day of
just
the week?
random, yeah.
Every day of the week?
Every day.
And there was nothing from a medication standpoint or any other things that you tried that was stopping it? I mean, actually a sustained relief?
Nothing.
Nothing. And now you're experiencing that with us. Excellent. So you're back.
For
And now we have
often.
another exam.
Yeah.
Excellent. Thank you. So I will be sharing some findings that I discovered in the first round, if that's okay with you.
Absolutely.
And the findings that we just discovered in the second exam today. And I think one main reason why you're back here for this round is because you're already seeing the improvement. That's been sustained improvement.
I've seen vast improvement
Vast
in
improvement.
every area.
Excellent. Would you recommend this to another parent who's dealing with syncope or seizure-like activity with their child?
Absolutely.
It's working.
POTS, Lyme disease, autism, ADHD. I mean,
It's
the list
working.
goes on and on.
Now we have a very active young girl who just wants to be known
So-
and be heard.
Mwah. Thank you.
Okay,
your
so
turn.
hopefully after this round, when we can see more improvement, that we can actually get her back on camera. Maybe she'll be speaking some full sentences then,
Yeah,
that we can all
amazing.
understand. Excellent.
And
Okay.
hopefully we can, get her brain working well enough and her nervous system working well enough that she might be able to start standing and walking even.
Oh, well, that'll happen, definitely. Right now,
that'll
what
be
you told
the-
me is that she's having a bit better balance because she used to sit up and then she'd fall over to the side, but that's not happening anymore.
That's not happening
So
anymore.
we're already seeing progress
I mean,
in that direction.
occasionally, but nothing like it. It used to be every 5 minutes she would, boom, hit the floor,
Just fall
boom,
over.
hit the floor.
But now that's not happening. So we can already see improvement in her nervous system to be able to do that. To be able to
Exactly.
keep some balance even in a sitting up position is great. But we're going to see in this round even more improvement because we found a sedative chemical. We found a sedative chemical that's in the brain, in different parts of the brain. So when we get that out of there, in the kidneys, in the intestines, when we get that out of her, which is the main cause of this right now, when we get that out of her, there's only one thing that can happen, is the body getting stronger, the nervous system working better.
Yeah.
Yeah. Okay.
I know, honey.
All
Just
right.
a minute,
Well, you're going to go eat now.
Mama.
All right. Well, thank you for helping me make this video. And then we'll look for the other video from you that we can share with people and help other people get well.
Sounds good.
Thank you. As you can hear in the video that you just watched, the mother exclaiming about how much improvement her daughter is experiencing now and what she's experiencing with watching her daughter, how much better she's doing with her ability to focus on her ability to remember things, for her ability to not have syncope disorders, where she was in the past losing consciousness multiple times in a day. And her mother actually reported to me that she had to do CPR on her very often in order to resuscitate her, in order to get her daughter to start breathing again. The doctors who she had seen, and there were many doctors who she had seen for her daughter's condition, just did not have any answer. They could not figure out what was going on with her, and it was just some sort of lack of proper development, and there was no real answer as to why it was going on. Other treatments that she had done prior to coming to me had not provided her any kind of sustained improvement or sustained relief from the condition. And it was called, she had diagnosed, the mother had self-diagnosed it as a reflex agnostic seizure or reflex asystolic syncope. And maybe they were thinking that maybe there was some genetic or family condition because, or in the bloodline, because the little girl, Onyx, her grandfather also suffered from a condition called POTS, P-O-T-S, a postural orthostatic tachycardia syndrome. And what was obvious, at least what her mother reported to me before we started working together, and her first examination with me was October 23rd of 2017, which then she started her first protocol probably about a week after that, sometime in the beginning of November of 2017. Her mother was telling me that when she was born, she came out and she was never okay. She had a sort of, as you heard in that video, a stoic kind of just not really normal presentation. She never had, her eyes were just like nothing was behind her eyes. And after a certain procedure where they did some rectal procedure to examine her brain with an MRI procedure that was done shortly after she was born, she even got worse after that procedure was performed on her. So she wasn't able to sit up and keep her body up. She would just fall over to the side. There was no ability even from a sitting position to balance. She has not, it's 3.5 years, she has not been able to walk yet. And now there are words or kind of as she called it, garbled, I think that's the word that she used there, but there are some, she can make out the sounds of the words that her little daughter is trying to speak, that Onyx is trying to speak. But there's much more vocal expression now than Onyx ever had before. And again, when I met her in October, there was very little, if any. There was, I think, zero when she was here, vocal expression, and her eyes were just a gaze type of dazed look in her eyes. As well as she had a condition where her pupils were switching. One was big, the other was small, and they would alternate in which one was constricted and which one was dilated. So that obviously from the pupil analysis, that there's some neurological disorder that's going on, and her inability to speak well or even form words and even focus on her mother. There was obviously some neurodegenerative, some type of neurological trauma that happened there. And this came right after she was born via C-section. There was no head trauma. There was no whiplash type of injury. There was no concussion. Now, in her first examination that helped us get her to this point of recovery, in her first examination, I found in her diencephalon of her brain, which is one of the most important parts of the brain from embryological to fetal to baby to human being development. The diencephalon of the brain is an area that we depend on from early on to be able to help us develop our whole brain and the whole body, therefore. I found, so when we have a developmental disorder, we have to think of that diencephalon as one of the first parts of evaluation of the individual, because if the diencephalon has some kind of infection and or toxin in it, then what's going to happen is that the rest of the brain can't develop appropriately, and we're going to have these other type of developmental disorders or malfunctions that take place. Then that's whether it's ADD, ADHD, or there's a POTS condition, or there's some type of seizure condition. It's possible that it's in the diencephalon, or the cause of the condition is in the diencephalon, or part of the cause of the condition is in the diencephalon, or even a condition like autism. We've got to look at that diencephalon and understand its functions and understand what type of toxic load or type of infection that's in that diencephalon that could be harming its ability to mushroom out the rest of the function of the brain and have the brain develop appropriately. Well, I found in her, which is part of her family history, I found tobacco smoke and tobacco toxins in her diencephalon. I found side effects from certain vaccine chemicals, side effects that were harming her diencephalon. I found bacteria, I found viruses, I found Stachybotrys black mold, I found insecticide chemicals and parasitic infections in her diencephalon. These were not allowing her diencephalon to develop appropriately, to develop and be able to have normal function of the brain and be able to focus on what somebody's saying and remember what somebody's saying, or even be able to stand up or speak. We've got to understand something, that a person, when we're born from our mother, and if the mother has any kind of toxin, let's say the mother was a smoker before she got pregnant and stopped and quit smoking when she found out that she was pregnant. The tobacco smoke and tobacco toxins that were already absorbed into the tissues of the mother's body are already in the bloodstream, and anything that's in the mother's bloodstream can get into the infant, okay, during the pregnancy, during that 9 months, 8 or 9 months of pregnancy. Any kind of infection or toxin, if there's candida that's in the mother's tissues, if there's any kind of metals like mercury in the mother's tissues, or she ate some foods that had some pesticide chemical sprays on them, any of these chemicals and infections, anything, whether it's candida, whether it's some bacteria, whether it's a streptococcus infection, it doesn't have to be what we call a sexually transmitted disease like syphilis or gonorrhea or chlamydia. Even if there was a throat infection that the mother had at some point in her life, and that infection just ended up down in her reproductive tissues, in the ovary or the fallopian tube, the endometrial tissue, or the uterus, the baby who is trying to form inside the mother's reproductive tissues is going to pick up any of those infections, or possibly can pick up any of those infections that's in the mother's womb, as well as any toxins that's in the mother's bloodstream. So we've got to understand that that even if and when a mother will quit smoking prior to, or let's say in the first month or 2 months of finding out that she's pregnant, any of those toxins that were in the cigarettes can get into the baby's tissues. As well as if the mother wasn't a smoker, we've got to understand that if the father was a smoker, and we're not talking about secondhand smoke as the only concern, we've got to think of whatever that man had absorbed into his tissues can very well get into the semen and get into then to impregnate the egg and then cause some toxic effect from, let's say, tobacco toxins that were in his bloodstream that got into the semen and could cross over into the egg and now end up in the baby. I found in her as well her frontal lobe, which the frontal lobe of the human brain in part is for cognition, for speech, for forming those words that we speak, for motor control of our body, for personality. The frontal lobe does so much for us. There's a little too much for me to explain right now or share all of those points of what the frontal lobe does, but in part it's a great part of our brain that helps us to concentrate and to speak. And I found tobacco toxins and black mold called Stachybotrys in the frontal lobe. I found also Lyme infection damaging her frontal lobe development, and parasitic amoebas damaging her frontal lobe development. A part of her upper brain stem, or part of the brain stem, if you've ever heard of the brain stem in the human nervous system, we have a brain stem that has 3 parts. There's an upper, a middle, and a lower part. The upper brain stem, which is known as the midbrain, it's also called the midbrain, and it's also known as the mesencephalon. The mesencephalon is an area that's really important for us to have normal function. We've got to be able to understand when the mesencephalon is not working well, we can have problems with the way that the pupils are functioning, because the nerve, the cranial nerve that goes to the muscle that controls the pupil size. Now the pupils are a black hole. The pupils don't have any, the pupils are just a black hole that let light into the eye through the lens and through the light enters the eye through this black hole called the pupil. The pupil doesn't get bigger and smaller. The pupil size can be changed because the muscles that are in the color of your eye, in the iris, we have these fibers in there that can squeeze down on the size of the pupil and make the pupil appear smaller or constricted. So if you took light, imagine this pen is a light tool that we shine into the pupil. When we shine that light into the pupil and the light hits the retina of the eye and stresses parts of the brain that we have our vision in, again, the eye does not, I didn't say this before, excuse me, but the eye doesn't see for us. The eye lets light in for the brain to see the image. We have 3 parts of our brain that are, well, more than 3 parts, but let's just say 3 parts of the brain, in particular, the occipital lobe, the parietal lobe, and the temporal lobe. These 3 areas are how we see images. We also have our optic nerve, and we have an optic chiasm. We have the retina of the eye, the macula of the eye. We have different parts of the eye and different parts of nerves in the brainstem and that integrate with the brain, but we've got to understand that the eye doesn't see for us, but the eye lets light in, and it lets light in through the pupil to hit the retina. What happens when there's too much light entering the pupil, too strong of a light? We're going to have a pupil constriction because of the light when there's a normal functioning nervous system. So when we shine the light in the eye, it stretches the retina, and now we get a signal that goes to the upper brainstem where we have a nerve, a cranial nerve, that goes over to the muscles that will constrict the size of the pupil. Now we take the light away from that pupil, and now we can see that there's less stress into the retina and less stress to the brain. Therefore, there's less stressful signals going to the brain stem. So we're going to see that the muscles now relax because the signal is not being carried out to the muscles that constrict that pupil size in the iris. when we don't have that stress and the muscles are not constricting the size, we'll see the pupil dilate when there's no light in the eye. Again, light in the eye, constriction, take away the stressor, take away the light, dilation. What would happen if there's some infection or toxin that's in the upper brainstem, also known as midbrain or mesencephalon? What's going to happen in there when that tissue is not able to control the pupil size appropriately? What happens if it's got excess, it's got hyper and hypo reflexive stress signals going from that part of the brainstem to the pupil? We can see one pupil that's smaller, one is bigger, then it can alternate. Whether it's happening that rapid or it's happening slower, maybe you see one pupil is bigger one day than the other one and it switches the next day. Whatever the case is, we've got to understand that that upper brainstem and any tissues that are neighboring attached to that upper brainstem or the cranial nerve that's coming out of that brainstem that goes to the eye. What if the nerve has an infection or toxin on it? What if the upper brainstem has an infection or toxin in it? Then we're going to see some different disorders with the pupils. And again, there could be other parts of the brain without a trauma, a head trauma, a concussion. We're going to see other parts of the brain that also integrate, that are neighbors, that are touching into that tissue, that are connected to that upper brainstem. When there is some kind of infection or toxin in a neighboring tissue, it can also cause the neighboring upper brainstem to start to have a malfunction. So that's a possibility as well. I found tobacco toxins. I actually found the mumps virus, parasitic flukes, damaging her mesencephalon. And I'm going to tell you causing a malfunction in where that mesencephalon controls, which is part of the eye, in part. I'm also going to tell you that I found recently that whenever somebody has used in the past, if somebody has used a condom, and on the condom there's a spermicide lubricant on that condom, what does spermicide do to the sperm? Spermicide, like an insecticide or pesticide, the purpose of that spermicide on the condom is to kill the sperm. Well, what's going to happen when that spermicidal lubricant absorbs through the woman's vaginal tissue and goes into the bloodstream, and it can go into anywhere in the body? Now, whether it goes into the mother's bones or her liver or her kidneys or just stays right down there in the reproductive tissue, when that spermicidal chemical stays down there in the tissue and now the baby is forming inside the endometrium, inside the uterus, what's going to happen when that chemical gets into the baby's brain? Is it going to allow the brain to develop appropriately? Or is it possible that that spermicide is going to now cause a brain malfunction to take place? Well, I found spermicide chemicals in her mesencephalon with a very unique bioresonance manual. No equipment, no computerized equipment. There's no machines here to do the type of work I do. There's all manual, hands-on. And it's a very detailed, intricate, very detailed study that I do in a human being. So I found spermicide chemicals in the mesencephalon, not allowing that mesencephalon to work appropriately. And we could see a pupil defect. I found in her corpus callosum. The corpus callosum, I'll show a picture here on the side of me. The corpus callosum is over 200 million nerve fibers that go from the center of the brain out to all parts of the cortex, or just about all parts of the cortex of the brain. And this corpus callosum, we've got to have normal neurotransmitters, serotonin, dopamine, GABA, acetylcholine, other brain chemicals that go through these nerve fibers called the corpus callosum, corpus callosum part of the brain. We've got to have normal expression, normal myelination of the corpus callosum. We've got to have normal oxygen supply. We've got to have normal carbon dioxide elimination from the corpus callosum tissues. And we've got to have normal transmission of these neurotransmitters so that we can have normal brain function. What's going to happen when the corpus callosum maybe has just a little bit of less oxygen to it? Not being choked up completely, but what would happen if oxygen is just a little bit deprived from that corpus callosum tissue? We can have a malfunction in different parts of the brain. Remedies were provided for her. For everything I've said so far, remedies were provided, pinpointed, safe and effective remedies were provided to remove the toxins and the infections of everywhere that I've listed so far in this first exam and first protocol that brought her to the point that you just saw in that video that her mother is very happy about. But also to remove, or I should say to stimulate the function of the upper brainstem, to stimulate the function of the frontal lobe, to stimulate the corpus callosum so we can improve the function of these tissues and get more oxygen into these tissues. I also found in a tissue where part of the brain, where the brainstem and the cerebellum of the brain and other parts of, without making you into a neurologist here, there's a tissue called the corpus striatum. I found vaccine side effects from certain vaccine chemicals and Lyme infection damaging the corpus striatum. I found in a tissue in her brainstem called the reticular formation, which is a very complex web of nerve tissue within our brainstem. Reticular formation, a very complex web of nerve tissue, and this reticular formation helps to stimulate a part of the brain called the thalamus, which then can stimulate other parts of the whole cortex of the brain for the brain to be able to know what tasks need to be carried out to have function of the body, whether it's speech, whether it's moving your toe, whether it's making your heart beat, maybe, and whether it's, making your pupils function, moving your eyeballs when you're looking at someone, or following something on a movie screen, or following a tennis ball in a tennis match. Your reticular formation does so much for you. Sensations of the face, moving the mouth, speaking, swallowing, breathing. The reticular formation is a key nervous system tissue inside our brain stems, which helps us to have these functions. What's going to happen when there's some toxin or infection, or plural infections and toxins that get into this reticular formation tissue? What's going to happen is that reticular formation can carry out the normal nervous system tasks. So we can have delayed development of the human body. We can even have an interruption. If we had normal development and we have normal function, then all of a sudden a switch flips one day and somebody says, why am I having this malfunction in my body? Like my digestion doesn't work normally, or my heart's not beating as the way that I expected. There's a rapid heart rate, or there's a lower than normal heart rate, or there's a high blood pressure, or a low blood pressure, or it alternates, it goes high and low, the blood pressure, or there's a balance problem in a patient, or there's a hearing disorder. The reticular formation, when there's a toxin or infection, or plural infections and toxins that get into this reticular formation, you can see, you can experience, or anybody can experience a malfunction to various parts of the brain and various parts of the body, because the reticular formation sends signals into the brain and carries signals from the brain out to the body, to the face, and to the whole body. So we can have any kind of disorder develop in the body from a damaging or a hidden infection in the reticular formation. I found dental resin, just because in her reticular formation, causing it to not work well. Just because somebody doesn't have mercury fillings in their mouth, or amalgam fillings, or also known as silver fillings, and we get with these white fillings, doesn't mean that that the white fillings are very safe. Now, I'm not saying that mercury fillings are great. I don't want them. I don't want metal fillings. And any of my patients, I tell them to remove safely, and doing it the right way, to get those metal fillings out of the mouth, because they're just not healthy. But just know this, that these dental resins and dental cements and other the white filling compounds that go into the mouth, they're not healthy either. They may be less damaging than the white filling, but there are many studies, I'll actually put one up here on the side of the screen, there are many studies that have shown that cytotoxic or cell toxic effects of these different white compounds that go into the mouth. So they're not safe either. I found in her parasitic flukes in what's called the red nucleus. There's a red nucleus as part of the brain that also carries out a lot of the function to the body, to be able to crawl, to be able to walk, to be able to swing your arms when we're walking, to be able to sense and have normal motor control of parts of the body. The red nucleus is one of the most important parts. They're all important in the brain, but it's an incredibly important part of our nervous system, the red nucleus. I found parasitic flukes and the retrovirus damaging her red nucleus. So remedies were prescribed to this, to the little girl, to Onyx, through her mother, who provided these remedies at home for her, and she started to notice incredible improvements. When she came back into my clinic for this visit, which was on February 21st of 2018, a few months after, which is about 4 months after I first met with them, she sat down with me with the biggest smile on her face, and she was just so, and I hear vocal expressions coming out of Onyx, and it was just amazing. And I could actually see her focusing on me, which we'll look for that video from her mother and add that into this video, or to another video where I'll share that separate from this video. But I was able to see her focusing on me. She was listening to me. I could see that there was not just a dazed gaze kind of behind her eyes. Now she was able to listen. She was able to follow her mother's instruction, which wasn't happening on the first visit. So there's a dramatic improvement. As her mother said, you could hear dramatic or drastic improvement since she did this first protocol. Speed of recovery varies from patient to patient. Let me just tell you, speed of recovery varies from patient to patient. We might see one person have a dramatic improvement in one round. We might see somebody have a slower improvement in one round than the other patient did. But you can get better when you can actually, with my unique work, with my unique skill and understanding of the human body, about the nervous system, the functional parts of the nervous system, the neurochemistries, these neurotransmitters, which I took extensive hundreds of hours of postgraduate studies in neurology, functional neurology, neurochemistry, immunology, the dental connections to disease of the brain and the body, cardiovascular, and the whole nervous system and organs, alternative cancer treatments, biochemistry, cardiology. I've done a lot of extensive postgraduate studies for the past 11 years of my life and my work. But we've got to be able to pinpoint these different infections and toxins in these tissues. So I practice, as I said before, a very unique kind of bioresonance method where I have samples of different tissues of the brain and the body, and I could find through a very unique stress reflex analysis which tissues in the brain are stressed, and I have various samples of these infections and toxins that I can actually pinpoint, matching the tissue to find the tissue is stressed, how to get it out of stress. So we can see when that tissue is stressed, let's say like the diencephalon, it's showing that it's in a stress pattern, a muscle tension pattern is developed when I test this diencephalon tissue, and the tobacco toxin sample takes it out of stress. We know we have a match. It's just like putting a light into the pupil. We have a constriction, we take away the light and it relaxes. We know that light was the stressor that made the pupil constriction develop, because when the light goes away, the dilation of the pupil happens. If I shine a light in somebody's pupil and the pupil, let's say the pupil is constricted and I put light there and there's no constriction change, it doesn't get even more constricted, and I take away the light and the constriction doesn't relax and become dilation. If it stays constricted, we know that the light is not causing it. Maybe they're on some drugs. Maybe there was concussion. Maybe there was a chemical exposure in the brain that made that constriction occur, where it's not the light that made it happen. If you can follow that. Rewind it, listen to that description again. I found with this patient, with Onyx, I found with her in this exam on February 21st that one of the biggest matches for still her brain, still stuck in even though there's a lot more improvement than, there's a lot of improvement than what she's had in the first 2.5 years of life. But what I found in her, I should say 3.5 years, excuse me. But what I found in her this time, that one of the most dominant toxins in her body was a toxin called xylocaine. Xylocaine is a numbing agent that they can inject into a person possibly before a C-section, or maybe it was used for a dental procedure or some other surgery where they can use this. The anesthesiologist may use this xylocaine to do some numbing of a tissue, just like Novocaine or Septicaine, that they can use in a dental procedure. Xylocaine is what I found in her, like lidocaine, a numbing agent. I found xylocaine in her blood. I found xylocaine in her diencephalon. I found xylocaine in her hypothalamus of the brain. I found xylocaine in her cerebral cortex tissue. I found xylocaine, excuse me, let me finish with that. Xylocaine in her large intestine, xylocaine in her kidneys, xylocaine in her bone marrow. I found in her also, there's another sedative chemical called Versed that can cause tremors and dystonias, muscle tone changes. I found Versed in her brain. I also found Candida glabrata in the capillaries of her brain. I found Candida tropicalis in her hypothalamus, in addition to the xylocaine in the hypothalamus. Whenever there are toxins that can numb the body or put somebody to sleep, sedating the tissue, sedating the brain for a surgery procedure, what's going to happen when those sedative chemicals or numbing agents are still in the brain of a person, or in the bone marrow, or in the liver, or in the large intestine, or in the kidneys? What's going to happen to the function of the person's body? If a sedation chemical, when a sedation chemical can actually sedate the brain, make somebody high and not function well, and get them ready for a surgery procedure where they use an anesthetic to knock them out, what's going to happen when that sedative chemical is still in the brain of the person who's trying to develop? It's stopping the development. Does that make sense? I hope it does. It's stopping the development. It's hindering the performance of the development of the brain. What's going to happen when a numbing agent, xylocaine, is in the intestines, in the kidneys, in the brain, in the hypothalamus, in the diencephalon? It is causing a decrease in the ability of those parts of the brain and body to work at regulating our blood pressure, regulating brain function and development, regulating speech and walking. It's stopping that development. It's hindering the performance of the brain and the body. We're getting those out, these chemicals and these infections. I'm getting these out of her brain with these remedies so that she can become stronger and develop better. She'll have a protocol in this round that will be about 50 days of steps with very safe and effective potent remedies that are going to go right into these tissues in the kidney, in the brain, in the diencephalon, in the large intestine to get these chemicals out. And we're going to see even more than what you saw in this video testimonial. You're going to see even more development with her. I expect to see that. They come to my office. They're in Washington State on the northern west coast of the U.S., down to my clinic where I am now in Florida, in southern Florida. And she's tried many things before coming here, and nothing gave her sustained improvement. And she's seeing sustained improvement now, so she's very happy, as you saw in that video. I'm going to share the video again so you can get a recap of what her mother's saying about her development. And again, look for another video I'll put up when I do get the video footage of her prior to her starting this protocol that she did, the first protocol. You're going to see the difference of her expressions and what they are like now. And again, getting the infections and toxins out of the tissues. And with my understanding of the nervous system and neurochemistry and immunology and endocrinology, it gives us a much greater wealth of putting the pieces of the puzzle together to help somebody achieve better function and development in their body. Listen, it can be done. We just have to have a unique system and think outside the box. It's not just staying within the paradigm that you may want to believe in. You can stay there if you want. But when you're really ready to start making a change, you have to be able to step outside the box, or should choose to step outside the regular paradigm of what you think is regular medical treatment or regular holistic or alternative treatments. Step outside the box, look at true science, which I'm practicing, which is based on some findings in biophysics and quantum physics, and you can really have an improvement. Okay, follow me on my Facebook page. I put information up there on a regular basis, and you could scroll through the posts that I've put up on my Facebook, where you can actually see some different posts and understand from a much deeper perspective of what's going on with people that I find, and you can hopefully gather a greater, deeper understanding, not to make you into a doctor, but a deeper understanding of the body, because you weren't born with an owner's manual, so you're depending on, not like the owner's manual that you got for your refrigerator or your car when you first bought those devices, but you're depending on different doctors and even some of these so-called specialists who don't help you or your family member get well. You're depending on these people who are top doctors in different fields and universities and hospitals who are not getting you there. You can get better, and here's proof of this work working for people. So follow on my Facebook. You can even connect with me on LinkedIn. I have information I put up there sometimes. On my Twitter account, I put tweets up sometimes as well. I have an Instagram that you can follow and click on some different links and watch some videos and posts that I put up there as well. And subscribe on this YouTube channel. I put information up here. When you subscribe to this YouTube channel, my YouTube channel, you're going to be able to get an email instantly when I put up a new post, and or a new uploaded video, I should say, and you'll be able to follow and really understand from a greater depth of understanding of what's going on with it. People are getting better with different conditions here in my clinic. Some people heal faster, some are slower healers. It just depends on the amount of toxins and infections that are driving the problem. But we can get to the root of the cause or causes of the neurodegenerative or lack of development or seizure-like or POTS type of condition and help you recover. Okay? Share this video with one friend, just one friend who deserves to know. It's very easy to take your phone and hit the share button, or on your computer just hit the share, as well as like this video. And call my clinic at 954-370-3100. That's call my clinic at 954-370-3100. And you can call and make your appointment through my great, very nice, very happy, soft-spoken female assistant. She's happy to help you make an appointment here, help you to work out with, flying in from another state or another country, as many people do come into my clinic. Every week we have people from around the world, literally, and across the United States, coming into my clinic for help for different conditions. And I mean, as far away as Thailand, New Zealand, Italy, from United Kingdom, Norway, Norway, Netherlands, Belgium, and United Kingdom, Canada, Venezuela, Mexico. I've had people come in from many different places here. Peru, coming into my clinic. Okay, so you can come from anywhere, and usually the stay here is just for a day, and you go back home, and we'll ship you the protocol, so you could follow that at home. For even Turkey, I've had somebody coming in from Istanbul, Turkey, and Russia and China. We've had come across into my clinic here. So it's not too far. If you've got to do what it's going to take to get you well, and you follow us and you see improvement here, you can get well, okay? So again, call my clinic at 954-370-3100, or send an email to my clinic assistant, and she'll be happy to help you. Just also know this, that regular health insurance does not cover this type of work. They don't recognize this work, and so there's no way for me to bill the insurance. This will be an investment for you or a family member or friend out of your own pocket. You've got to invest in yourself if you want this type of work, and there's nothing I can do about how insurance companies work or what the government does, but I can work very diligently, very hard to be able to help you figure yourself out and get well. Help you get well, I should say. Again, 954-370-3100, or send an email to my clinic assistant, and we look forward to helping you too.